Now, I want to move on to our third presenter. And our third presenter is Madam Julia Tagwireyi, the former Director, Food and Nutrition Council of Zimbabwe and Director of Africa. Now, Julia, tell me, as a public health nutritionist and advocate over the years, decades in fact, what do you think has been the missing link in bridging the gap between policy and action at the community level?
Good afternoon, everybody, and thank you for that question, Francis. In my 40 years experience in the public nutrition field, I honestly believe that effective engagement with communities affected by malnutrition from the onset maybe is key. There are examples where this has happened, but it's not happened long enough. We need to engage communities even in the policy-making process. Communities have indigenous knowledge, practices, that have produced well-nourished children. In spite of the gloom and doom, we talk about 30% stunting, 40%, even in some areas a bit 50%, still more than 50% of African children are well-nourished. They're okay. Do we know why? They're coming from the same community. Have we bothered to learn enough about what those families or mothers are doing that we can build on? I think for me, that is an underutilized resource. As Isatu mentioned earlier, our people have a lot of indigenous knowledge, which perhaps our researchers and even our practitioners, in our quest to do good, we mean well, we meant well, I include myself, in a hurry to fix those that were malnourished, we did not pay too much attention to what was there. What was already there that was making family X have well-nourished children in the same community, same environment, but somehow their children were okay. Yes, there is room for blending new science, new knowledge with indigenous practice so that we can accelerate faster. But I think we've done ourselves a great disservice by not looking at what we have and building on it, using whatever the new science we have learned over the years. And I believe the other underutilized resource that probably is also delayed. And as African, I think we're looking to see how we can facilitate making that distance between community and policy shorter. There are stakeholders who are the interface with communities on a daily basis. And unfortunately, the burden of talking about nutrition or sharing whatever nutrition information or knowledge we have has largely fallen on the health sector. And they've carried the burden. But there are other stakeholders that are out there interfacing with the community, whom we need to more effectively nutritionalize, such that not only do they see their role in nutrition, but embrace it and mainstream it into their mandates, such that it's not an add-on, it's not like a pimple that has grown on your nose and somehow, yes, it's there, it wasn't meant to be there. But they embrace it as part and parcel of what they do as their normal day-to-day work. And I think we've not been as effective. I think the fact that now we're talking of nutrition-sensitive agriculture, that's a good beginning. But we have other stakeholders we need to reach out to, the traditional leaders, we have the education sector, we have stakeholders in local government, parliamentarians, for example, community-based organizations, including faith-based organizations. We have paid lip service to engage in them, but I think our communities are engaging with so many different stakeholders, local businessmen. What role can they play? If we can effectively engage these stakeholders and sectors that are closer to the community, perhaps the pipeline from policy and strategy to community can be shortened. And it is honestly my belief that this can happen. And as one of the goals of African is to have nutrition literate communities. Communities that are able to make informed decisions and choices about the nutrition of their family, so that we no longer talk of malnourished, or we no longer talk of nutrition campaigns that are supposed to educate everybody. I mean, I was reflecting on the developed world, Europe and America. You don't hear of mass nutrition education campaigns, largely because a lot of their population, through the education system and so on, are aware, reasonably aware. They can make informed choices. We need to be at a place where our communities are knowledgeable enough about nutrition, the role they can play, because they're the first nutritionists. Some of us had to study 4 or 5 years but the first nutritionist is the mother and the father in the home. Some of them actually know what to do, but a lot maybe don't. And it is my belief that bridging that, narrowing that gap between the well-meant policies, Africa is so abound. And I really get a bit fed up when I hear we need more political commitment. It's there. After all, we, the technicians, are the ones who make our leaders sign these things. Translating them, operationalizing them, whose job is that? Is it the president to operationalize Malabo? They are there, we have to action them. But at the same time, our communities may not even be aware of these good intentions that their countries or their governments have in store in terms of uplifting their food security and nutrition. So I believe effective engagement of communities as partners around the table, where we also learn from them, embrace the good indigenous knowledge and practices that may exist, and have a hybrid with new modern thinking, new research and new information that is continuously emerging. So I believe in a nutshell, a more effective community engagement from the onset may help bridge that gap.